Hi, it's Jon Mitchell, Mayor of New Bedford, and this is another installment of the Mayor's Weekly Update. So this week, I just want to talk about COVID. As we know, cases are going through the proverbial roof. We've averaged this week nearly 200 cases a day, which is a lot more than it was a month or so ago, and a lot more even during the spike last year. And so, there's cause for concern, and there are lots of folks who are understandably anxious about what's happening. They're anxious for themselves and their family members, their children, their parents, and so I want to speak to that. We're in a different phase now than we were last year. Last year, at this time, we had lots of cases, but no vaccines. We have vaccines now. We know a lot more about the disease than we did before. And we also know that these surges do pass over time. And the trick is to make sure that the transmission slows down enough to keep our hospital system going. There are some pressures on our hospital system right now. It's particularly about staffing. They don't have enough people to staff the level of patients that are in there now. The number of patients is up, but not nearly as much as it was last year. But they have fewer people in the hospital to address those patients. So we're concerned about that. So really, what's the approach? The approach now is really not to suspend common sense. We're starting to learn to live with COVID and to start to manage it. And this is a tough transition that we're making right now because there's still a lot of vulnerable folks out there prone to the disease at a time when there's a lot of disease around. So, we use the tools that we have, that we're all familiar with by now. Social distance from one another where you can. That physical separation, especially indoors, is important. And where you can't do that, wear a mask, especially a high-quality mask. That's important too. Vaccinations, we've said it again and again, they matter an awful lot. The people who are dying in the hospital now are under-vaccinated, some entirely unvaccinated, but almost every single one to a person here in New Bedford, not talking about the rest of the country where it's also true, but here in New Bedford, it's people who are under-vaccinated. So what does that mean? If you are still reluctant about the vaccines, again, the best thing you can do is talk to your doctor about it directly and get your doctor's opinion as you would for any other medicine. I would also strongly suggest for those who are vaccinated but haven't had that booster yet that you go out and get that booster. That's really important. The boosters do count. They do matter. They do work. And we're seeing it again and again. We get the reports from South Coast Health all the time, and that's something that we really need to keep an eye on. And we really need to take advantage of those opportunities. So if you haven't gotten that booster yet, there are places, there are clinics around the city, including your medical providers, that can offer you that booster. So that's really important too. The other thing I'll just say is this. If you have a loved one who is vulnerable, either because of age or some underlying health condition, or both, you really need to be careful around that person. Visiting, an elderly relative right now, especially one that hasn't had that booster, can be really dangerous, even if you've been vaccinated. So that's just a word of caution. This week in the last week we've had more than 10 city residents who've died of COVID right here in St. Luke's Hospital. And again, those people are all under-vaccinated. We just have to keep these things in mind when we're dealing with folks we love that have underlying vulnerabilities, especially if they're under-vaccinated or certainly not vaccinated at all. So it's all these things that make sense. None of what I just said is entirely news breaking. It's all things that we're familiar with, but these are the things that we need to do to slow the spread of the virus down, to bring the surge down, so that we can get back to a place that's more predictable and a lot less anxiety-provoking. So we're going to continue to work on it. You'll continue to hear updates from me as time goes on. But with all that, this has been the Mayor's Weekly Update. We'll see you next week.